This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome, listeners, to the 21st Century Man podcast. Here we take a deep dive into profound insights and practical strategies for modern masculinity. We explore each chapter of the transformative book, The 21st Century Man. Today we're unlocking a really fascinating section, Chapter 83, Platelet-Rich Plasma, PRP for ED and more. Our mission really is to unpack the surprising origins of PRP therapy, understand exactly what it is, and then explore its wide-ranging applications, especially for men's health, as outlined by Charles Runels, MD. This chapter truly exemplifies the book's commitment to pushing the boundaries of health and performance.
Absolutely. And this deep dive will offer you a kind of shortcut to understanding a therapy that's making serious waves in regenerative medicine, helping you grasp the core science, the practical applications, and some genuinely actionable insights. It's a powerful example of how innovative thinking in medicine can address, long-standing challenges and significantly improve quality of life.
Okay, so let's start at the beginning then. Our sources kick off with a truly surprising origin story for PRP. We're talking elite athletes and multi-million-dollar racehorses. Why them? What does that tell us about PRP's potential? Seems like an unlikely start.
It really does, doesn't it? But what's fascinating here is how very specific, persistent problems in certain fields drove this innovation. You had sports doctors, orthopedic surgeons, even veterinarians facing this unique challenge. Tissues with incredibly poor or sometimes no direct blood flow. Think about the cartilage in a knee or certain areas in dentistry.
Areas that just don't heal well on their own.
Exactly. A surgeon working on a knee joint, or maybe a dentist dealing with a wound around a tooth if there isn't immediate rich blood supply right there. Well, there's little to no natural healing. These tissues are often called avascular. They just lack that direct blood pipeline, making natural repair almost impossible.
So blood flow is the absolute key because it brings the healing stuff. But what exactly is happening in the blood that makes it so crucial, especially in those hard-to-reach places?
Yeah, what's key here is how platelets, these tiny little cell fragments in our blood, get activated. Most people know platelets cause clotting, stop the bleeding, right? But that's really just the start of their magic. When they're triggered, they kick off this complex chain reaction. They don't just form a clot, they also create something called a platelet-rich fibrin matrix. Think of it like a natural scaffold or framework.
Okay,
But even more importantly, these activated platelets immediately release this powerful cocktail. Over 140 different growth factors right into the injured area. These factors are what initiate and dramatically speed up the healing process. So it was these specialists, the ones dealing with those really hard to heal tissues, who figured out, hey, what if we concentrate these growth factors to boost healing in these specific small spots?
That makes so much sense, leveraging the body's own toolkit, essentially. Now let's dive deeper into PRP itself. You've mentioned platelets and growth factors. How exactly is it made? What are these growth factors doing?
Right. So platelets, as we touched on, have that dual function, stop bleeding. Everyone knows that one. But their less known, equally vital role is releasing these potent growth factors. And like I said, over 140 of them. These factors are absolutely essential for tissue healing, for regeneration, even for growing new tissue, by basically telling cells, hey, repair yourselves, replicate.
Okay.
And creating PRP. It's actually a remarkably simple process, usually done right in a medical office. They draw a small sample of your own blood, just like a regular blood test. Then this sample gets spun in a special machine, a centrifuge.
Right, I've heard of those.
Yeah, and the spinning action separates the blood parts based on their weight, their density. Heavier red blood cells sink down, the lighter plasma floats up top,
All right.
and the platelets. They settle right in the middle, forming this concentrated layer. Sometimes it's called the Buffy coat.
Buffy coat, got it.
That's where these vital platelets are packed together, ready to be extracted. This concentrated healing solution, the PRP, is then precisely injected back into your body wherever that healing or rejuvenation is needed. And the huge advantage, the key safety point, is that since it comes from your own blood, there's virtually zero risk of rejection or an allergic reaction.
That's a massive plus.
Yeah.
Okay, so success was proven in knees, teeth, orthopedics, dentistry. What was the next step? Where did it go from there? How did someone think to use it on, say, faces?
Well, the move into facial plastic surgery was a kind of a natural progression. They were leveraging PRP's proven ability to improve healing, rejuvenate tissue, for things like wound healing after surgery, improving skin texture.
Makes sense.
But then the author of our source, Dr. Runels, he took it that crucial step further. He heard about PRP giving new volume and blood flow to the face, and he had that light bulb moment. Wait a minute, if it works in the face, maybe it'll work in the penis. And that bold idea, that leap, directly led to the development of what we now know as the P-shot.
And the chapter mentions he tried it on himself first, despite being terrified, apparently. What were the risks? That takes some serious guts.
Oh, absolutely. It really speaks to the dedication of a pioneer, doesn't it? He was facing potentially terrifying side effects, things like cell death necrosis or even priapism.
Priapism.
Yeah, that's a prolonged, very painful erection that can actually cause permanent damage. Serious stuff. Yet, he put himself on the line, driven by the potential to help others. And from his initial self-experimentation, it then logically expanded to women, leading to the O-shot.
Right, the O-shot.
And this just demonstrates a critical principle in medicine, adapting successful therapies to new anatomical areas where there are similar biological needs. The O-shot, for instance, applies the same regenerative ideas to improve sexual function and decrease urinary incontinence in women. The book really emphasizes that for, pretty much every aspect of male physiology, there's a corresponding female organ. So these applications, physiologically, are quite logical extensions. It's all about harnessing the body's own healing power wherever it might be beneficial.
The chapter says PRP has so many uses, with as much research, with so few serious side effects.
Yeah.
That sounds almost too good to be true. You've highlighted the safety, which is great, but are there limitations? Does the book talk about what it can't do, or maybe common misconceptions?
That's a really important question, yeah. While PRP definitely has an excellent safety record again, because it's autologous, from your own body, it's crucial to understand it's not a magic bullet. It's not a universal cure-all.
Okay.
Think of it like antibiotics, right? They don't work for every single person with pneumonia. Same idea here. PRP won't work for absolutely everyone in every single scenario. Its potential is huge, no doubt. New applications are constantly being researched, even in places without a lot of money, because it's relatively accessible. But the book stresses it's a powerful tool. But like all medical therapies, it has limits. It has specific indications where it works best. It's really about selecting the right patient for the right treatment.
That makes sense. Good context. Okay, let's dive into some of those specific applications for men, starting with sexual medicine. The book lists several problems where PRP, specifically the P-shot, works wonderfully, at least for some men. What are those key areas?
Right. The book outlines several significant applications for men's sexual health where the P-shot has shown considerable promise. Let's break those down.
Great.
First, probably the most well-known is erectile dysfunction, ED. Now, ED can stem from different things, right? Decreased blood flow, venous leakage. That's where blood leaves the penis too quickly to maintain an erection, or maybe nerve dysfunction.
Okay.
The P-shot seems to help by increasing blood flow, decreasing that venous leakage, and potentially even helping to grow new nerve tissue. The procedure itself involves numbing the penis, then injecting the patient's own PRP into the corpora cavernosa.
Those are the main chambers.
Exactly, the two chambers that fill with blood for an erection, and also into the glands, the head of the penis. Often, this is combined with using a vacuum pump device afterwards to optimize blood flow and tissue growth. And the book mentions men typically see their ED score improve by about 7 points on average on a standard scale of 5 to 25.
7 points is pretty significant.
It can be, yeah. And the unique thing here, unlike maybe some pills that just temporarily boost blood flow, is that PRP's real potential lies in its ability to fundamentally regenerate tissue and blood vessels. So it might offer a more lasting improvement by addressing the underlying cause. But again, important note, it's not for everyone. If someone has, say, severe, long-standing diabetes with extensive blood vessel damage, or if the nerves are completely severed, PRP might be less effective.
Understood. What's next?
Next up is Peyronie's disease.
Ah, yes, the curvature.
Exactly. This is a condition where scar tissue forms inside the penis, causing it to bend or curve. Sometimes it's so severe it makes sex difficult or even impossible. Now, we know PRP has this remarkable ability to help remodel scar tissue into more normal, healthy tissue. So it makes perfect sense that the P-shot has shown, as the book says, wonderful results for Peyronie's, especially when it's combined with using a penis pump, which helps stretch and straighten the tissue during healing. It's not just breaking down the scar, it's signaling the body to replace it with healthy, flexible tissue. That's a powerful restorative process.
That sounds incredibly helpful for men dealing with that.
Yeah, okay, what else?
Then there's the concept the book calls genital mismatch. And the chapter is careful to acknowledge, sexual fulfillment is diverse, connection and pleasure happen in many ways, regardless of specific anatomy. But for some couples in love, age, and life events like childbirth for women can sometimes lead to this not-so-funny trick, as the book puts it. The vagina might become a bit larger, and for men, the penis can subtly shrink over time due to various factors like loss of endothelial cells. I see.
In these specific cases, PRP often combined with vacuum devices, maybe traction, and supplements like Affirm, which is mentioned as a blend for male sexual health, might help increase penis size. The book notes seeing maybe a 10 to 20% increase in size. And interestingly, for a 6-inch penis, just a 1-inch increase in girth can effectively double the volume. So this can help reestablish that pleasurable match for some couples. It's about restoring a kind of physiological compatibility.
Fascinating application. Are there others mentioned?
Yes, a couple more key ones. Lichen sclerosis, specifically of the foreskin, also known as BXO. This is a chronic inflammatory skin condition. PRP can be injected directly into the affected area, and the chapter reports great results. Here, it's leveraging PRP's anti-inflammatory and tissue healing properties for a condition that often has limited options. And finally, recovery after prostate surgery. The P-shot can enhance the standard recovery protocol for men after a prostatectomy. That protocol usually involves using a vacuum device regularly, maybe low-dose Cialis, supplements like Affirm. Adding the P-shot helps the penis regain function faster and maintain its pliancy, preventing it from becoming sort of contracted. It basically helps men recover better and potentially faster after that major surgery, mitigating some tough side effects.
Wow, that covers a lot of ground in men's sexual health. Now, the chapter doesn't just make these claims, right? It mentions research. Tell us about that key 2021 study on PRP for ED.
Yes, this is a really crucial detail for you, our listener, to note. In 2021, the Journal of Sexual Medicine, which is a top-tier, peer-reviewed publication, published the first randomized, double-blind, placebo-controlled study on PRP injections for ED. That's the gold standard for medical research, as you're
Right, the highest level of evidence.
Exactly. They had 60 patients. They found that a significant 69%, nearly 7 out of 10 of the men who received actual PRP, saw improved erectile function. Compare that to only 27% in the group that got a sham injection, basically saline, and their sexual health scores improved by 20% at the 6-month mark. Importantly, 0 side effects were reported by anyone in the study.
That's pretty compelling data.
It is. And a key actionable takeaway from that specific study for anyone considering the P-shot is that the PRP machine they used was a double spin system, and they drew 60 milliliters of blood. So if you're exploring this therapy, you might want to ask if your doctor uses a similar protocol, aiming to replicate the success seen in that foundational research.
A good practical tip. And speaking of finding a doctor, the book is very clear on recommending certified providers, isn't it?
Yes, absolutely clear. If you're considering the P-shot, it's vital, the book stresses, to have it done by someone who is certified and licensed by the Cellular Medicine Association. You can actually check their directory online at priapushat.playcom. This helps ensure you're getting a quality procedure performed by a trained professional using an FDA-approved kit and the correct protocol. It's about safety and getting the best possible chance of effectiveness.
Makes total sense. So we've talked about the procedure, the applications, the research, but it sounds like maximizing the benefits isn't just about the injection itself. What does the book say about optimizing the results?
Yeah, this connects back to the bigger picture, doesn't it? It's really about holistic health. The benefits of PRP are significantly optimized, the chapter argues, when the whole organ system is considered. Lifestyle factors play a massive role. Things like good nutrition, getting adequate rest, avoiding excessive alcohol, managing other chronic diseases like diabetes or heart disease, and ensuring you have sufficient levels of key things like vitamin C, thyroid hormones, growth hormone. These can all significantly enhance PRP's effects.
So the injection works better if the body is already in a good state.
Precisely. The chapter even shares some powerful anecdotes, stories of men years after prostate surgery who recovered function with the P-shot protocol when these other factors were addressed. It demonstrates that when it's done for the right reasons and with that comprehensive support, PRP can truly be life-changing. The body's healing potential is just amplified when it's supported by a healthy overall environment.
That's a great point. And finally, there's this really forward-thinking concept from Dr. Runels, proactive health.
Well,
He suggests maybe we shouldn't wait for things to decline before considering therapies like this. It's quite a shift in thinking.
it really is, and it raises this important question. Can we use PRP proactively? as a preventative measure. The author suggests, well, maybe, just like a high-performance car, like a Lamborghini, needs regular tune-ups to stay in peak condition. Perhaps a P-shot once a year could potentially help prevent erectile dysfunction, keep men healthier than they might have been otherwise.
Preventative maintenance for the body.
Kind of. He even muses. He wishes he'd invented it for himself when he was 17. He envisions a future where proactive PRP might become part of routine health maintenance for coming generations. It's definitely an intriguing thought. It pushes us to consider preventive health in a whole new regenerative light, doesn't it?
Absolutely. Wow, what a deep dive into Chapter 83, Platelet-Rich Plasma, PRP for ED, and more. We've gone from healing multi-million-dollar racehorses all the way to these revolutionary regenerative therapies for both men and women, using our body's own incredible healing power.
It truly showcases the incredible potential we have when we learn to harness our body's own healing mechanisms. The insights shared in the 21st Century Man are, I think, genuinely eye-opening, offering practical, really cutting-edge information that can truly improve lives.
We definitely encourage you, our listeners, to pick up the 21st Century Man and explore these concepts further for yourself. The detailed information, the actionable takeaways, they're just invaluable. A real roadmap for optimizing your health. Please join us next time on the 21st Century Man podcast. We'll continue our exploration of this transformative book, diving into Chapter 84, Stem Cell Medicine. What does the future hold? You really won't want to miss that one.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.